Hey guys, it's Autumn and Dr. Coulter here at Family and Aesthetic Medical Centers, and today we're going to be talking about health literacy because October is Health Literacy Month. So Dr. Coulter, what does health literacy mean to you?
I think it's really just about making sure that there is clear understanding and communication between healthcare providers and people receiving health care. You might want to pause because everything.
So basically, health literacy is knowing what's being said at the appointments, knowing what's going on with your own health, and just kind of understanding what's going on.
Correct. And it's really important for that to happen because if not, then it can affect how the person perceives what's going on in their visit, and it affects their actions when they leave a office or a hospital facility.
I completely agree. So whenever you're explaining diagnoses to patients, it's really important to break it down, make sure that they understand what's going on. But what do you typically see that patients usually, or that may affect their health literacy or their knowledge?
Oh my gosh, there's so much. So I think the first thing to keep in mind is that when we talk about health literacy, it's not really about like education level, right? Because most people did not go to medical school, but it's really about, did they receive the information in the way we were trying to give it? And what usually happens is that most people in the healthcare industry, whether it's doctors or nurses or whatnot, we all were taught a completely different language when we went to school. Right? And so we talk a whole lot of medical jargon. And I think one of the things that's important is we're so used to talking to each other that way, but we don't remember that the patients that we're talking to did not go to medical school. So when we're using words like hypertension versus high blood pressure, or when we're using things like sodium content versus salt, that can make a big difference. And does the person really understand it, right? So we're saying blood transfusions and all these different things, and the patient is like, I am not really sure what's going on. So I think it's really important for us to slow down and then speak in a way that everyone understands. So making sure that we speak in layman's terms is going to be really important. And then it's also really important for the patient to feel empowered to say, you know what, can you break that down for me? Because I wasn't really aware or sure of what you meant by that. And so we want to make sure that when people leave, they have a clear understanding of what's going on.
I completely agree. I think that whenever people understand what's going on, then they're more invested and they kind of have like that knowledge is power. So if you know why high blood pressure affects your kidneys, well, kidneys disease is very, very scary. So if you know that happens and you know why that happens, then you're more dedicated, or then you're more focused on like, okay, well, let me get this under control. And then if you have the knowledge and the tools to know how to get it under control, you're more willing to, or more able to follow through on it.
Yeah, and I think it impacts even the relationship between the patient and the provider, right? Because there's so many misconceptions that providers walk away with, wherein the patient comes back and they did not pick up their blood pressure medicine, or they say, oh, I stopped taking that because my blood pressure looks great, you know, so to speak. And the provider says, oh, well, they're non-compliant or they're not following the regimen. And it creates this kind of like, just separation in the relationship that the provider and the patient can have. Whereas they didn't, you know, you have to stop and say like, why didn't they pick up the medication, right? Was it because the medication was too expensive? Is it because their insurance didn't cover it? Or is it because they didn't even know that it was really for blood pressure, right? Because they may have been like, oh, that we were talking about so many different things and I thought that was just an antibiotic. And so I finished it, I felt better, but they didn't realize it wasn't exactly for that. So I think it's really important to ask the patient, even when they come back in, well, tell me why you didn't pick this up, or tell me what you understood about this. And, you know, you'll find it, you know, really interesting that most patients, when they come in, if you even ask them like, which medicines are you taking, right? Most of them can't even say these crazy names that we have, right? All these scientific names. They'll tell me like, oh, well, you know, the little white pill or the green pill or that kind of thing. So it's really important just to make sure that when we talk through it, even if your patient says, well, I'm not really sure what it is, have them just bring all of their pills, and then you can go through it with them so that they can understand. And then the patient can ask questions of like, well, how long do I have to take this medicine? Because some of them are really surprised if it's like a chronic disease, right? Like high blood pressure or diabetes or cholesterol or prevention of heart disease and strokes. And you're like, oh, well, you're gonna, you know, stay on this medication to prevent a heart attack. They're like, wait, forever? You know, and they didn't understand that like, I have one example, one patient, we sent them medications. They had a 30-day supply. They had refills, but they were like, oh, I finished that when the 30 days ran out, and they never went back to pick it up. Why? Because they didn't have a clear understanding of how long that they were expected to take the medication.
No, I agree. And like a lot of terms with medicine, like you say, it's a new language. And so people who work in it, they learn it. But even if you come across different providers, I'm pretty sure we say medicine differently because nobody actually teaches you necessarily how to say it. So a lot of the jargon is difficult. But at the end of the day, like if you just have a list or if you bring all of your medicines, you are already 10 steps ahead. And that puts you at so much of a better place. We can even go through with the Sharpie and write on each container, what is this medicine for? So that you know, like, oh, my blood pressure is high. Did I take this specific medicine for it?
Exactly. So Autumn, as we talk about health literacy, what are some ways that we can actually impact our community and improve it, overall to make sure that everyone's getting the information that they need?
Yeah, in a lot of communities, a lot of diseases or chronic conditions are seen throughout. So for example, I'm Hispanic, so we see a lot of like cholesterol, a lot of diabetes, and a lot of high blood pressure. So if you know how to treat that yourself, or if you understand why you're taking these medicines or why you're reducing your salt intake or why you're reducing your sugar, then you can spread that with your community and make sure that your family, your friends, everybody around you also knows this too, so that as a community, you can just kind of develop healthier habits and hopefully longevity with your life too.
Yeah, that's really important because when I think about like my own family, right? If I know that lots of high blood pressure runs in my family, and cooking with salt can impact that, then even a way that like I cook in my household is going to be different, which will impact my children and my children's children and go on for generations. So that's really important that like one person can make a whole impact on community and make change. What about some tips that you would give healthcare providers, right? Because we're really good here at Family and Aesthetics Medical Centers about like breaking things down, right? We bring our patients back, we talk to them about their test results. If they see a specialist, we bring them back and we say, hey, do you have any understanding of like what happened in that visit as we're looking through those notes? And most of the time we're sitting there explaining to them what the doctor wanted them to do or what impact that test had on them. So like, what are some tips you can give some healthcare providers, right? As we look at health literacy.
I think a big one is analogies, or just making sure that patients understand what is going on with the disease or the chronic condition that they have. Now, you don't have to explain in depth why rheumatoid arthritis, what antibodies affected or this or that, but just explaining that like, okay, this is a full body disease. If it is a full body disease, it can affect any joints in it. And what does that mean for you? How can we prevent this? Just kind of breaking it down.
Yeah.
A good way to test understanding is if patients are asking questions. Some patients, if they don't understand anything at all, they don't even know where to start with questions. But if they're asking questions and probing, it's like, okay, then we're getting to the meat of it, and getting to discussing why you're taking these medicines, what you understand about this, and everything like that. It takes time, but it's arguably worth it because your patient outcomes will be better, and hopefully their patient or their experience with you as a provider also will be better too. They'll feel better cared for it, and like they're actually understanding what's going on with their body.
Yeah, so this is a good month for everybody to just kind of think about how they can improve their own health literacy, right? So things like when you go to the office, maybe bring a pen, some paper, or even use your cell phone and type in your note section so that you can remember some of the things that you guys talked about. Asking for a printout at the end of your visit might be really helpful, or even asking your pharmacist to print out a list of all your medications that you pick up from the pharmacy so that you can review that with your doctor or your provider the next time you go. And then for all of us in healthcare, just remember to like slow down. Remember that your patients did not go to school with you. And so making sure that you break it down in layman's terms to make sure that if it's like your friend or your homegirl or homeboy or whoever it is that you're talking to, that they would understand it too. And I think if we can slow down and do that and take the medication and medicine part of it out, then I think our patients will have a much better understanding of what's happening in those visits. And it helps to foster the relationship between you as a provider and your patient as well. So as everybody's looking at October, also think about health literacy awareness. And if there are things that you can do to support loved ones, go with them to the visit. Sometimes that will help, especially like elderly population or things like that. And so we really want to celebrate this month of October. There's a lot going on in the month of October, but don't forget about health literacy.
If y'all have any questions or concerns, or if you are struggling with your own diagnosis or chronic conditions, come on by to Family and Aesthetic Medical Centers and we'll help you out.